There are two presentations at this EHA meeting concerning Pacritinib as assessed in the PERSIST-1 study. The first is the primary endpoint of the study. This is a study randomising patients with myelofibrosis between the oral JAK inhibitor Pacritinib and comparing it to best available therapy, very similar in design to the COMFORT-2 study. The endpoints of the study were symptom response and also spleen reduction, exactly again like the COMFORT studies. This study, however, is slightly different, and it's important to remember that before we look at the results. In this study, there was no lower limit for platelet count for the patients who entered the study, and there was no requirement for a specific symptom burden. The patients, however, had to have had no prior JAK inhibitor therapy. The results of the study are very promising and exciting for the myelofibrosis patient community because Pacritinib was able to deliver good responses in terms of spleen volume reduction of the order of 20 to 25% compared to best available therapy, which was highly statistically significant, but also strong responses as well in terms of symptoms. An additional feature which was very important for Pacritinib treated patients is the surprising perhaps finding, but builds on data from earlier studies, that there was not very striking hematological toxicity. What does that mean? That means there was not a significant lowering of the hemoglobin or platelet count with Pacritinib when compared to best available therapy. Also, those patients who were enrolled in the study with very low platelet counts, less than 50, for example, still had the same degree of response as the patients with a more normal platelet count. In addition, lastly, a further important and exciting finding was the fact that using Pacritinib therapy, 25% of patients became transfusion independent. This is very important because patients with myelofibrosis often have anemia and many of them require blood cell transfusions. So to be able to deliver responses for spleen size, for symptoms, without causing an increase in anemia and for some patients avoiding the need for transfusions is an extremely positive and strong finding for this drug. The second set of data from Pacritinib just builds on that in terms of looking at the symptomatic burden for these patients. These patients have very advanced disease, often very low blood counts, and they were getting rapid and sustained responses to treatment. Concerning adverse effects, one of the adverse effects that is more unique to Pacritinib compared to Jakafi or ruxolitinib is diarrhea and nausea. Importantly, this led to very few treatment discontinuations. When we looked in detail at our patients, very few of them went on suffering these side effects beyond 1 week, and so that meant that they were able to continue taking an effective dose of drug. In summary, I think this suggests that Pacritinib could well be a very useful drug for the future for patients with myelofibrosis. There's an ongoing study known as PERSIST-2 for patients with low platelet counts, less than 100, with this agent.